Alright, hey guys, I just wanted to do a quick video. I never really seen anybody do one on drains, how to actually do it. The nurse at the clinic will explain how to do it, but it's kind of nice to know ahead of time, what you're gonna get into and stuff like that. So I will warn you, there's blood in it a little bit, but it's all in the tubes. It's not out and gory or nothing like that. So, give you a little bit of warning on that. But I figured it would, I try to help out as much as possible and, give everybody a heads up on things as I go through them, like everybody else on YouTube has done for me. So I just want to give back. And so here we go. Okay, you can explain what you're doing.
Oh, okay. I just got done draining it with the alcohol swab. I pulled it from here down. What I did was I pinched, pulled, pinch, pull. And then you get a little cup.
You measure it by cc's.
You measure it by cc's, so I'll turn it around. Throw it away.
And we've noticed if you we noticed if you open this valve here, it will be easier to milk it or whatever, strain the blood out of the tube.
It doesn't have any bacteria or anything. And then face it away from you, squeeze out all the air, then put the drain
Cap back on.
Yep. So then it looks like this. It's all flat. So what it's doing is it's pulling all his liquids out, if he can feel it or not. He said he could feel it in his chest once I do that. When I did it that way, he said immediately right away he could feel gurgling in his chest. So that means the suction's getting better and better after I do it. So then when you're done, you just unpin it and then repin it back to his vest very carefully.
And the nurse will explain all this to you, but I figured I'd just show you guys from one person to another how to do it.
There. And then you repeat the process with the other side. Take it off. Open it. Just make sure it doesn't smack you in the face with gunk. And as you can see right here, it's okay to have stuff like that. That's a little blood clot. And all you do is just you keep working it out. So then that way you don't get an infection or anything. It's just really easy to work out. Even if you're scared to pinch it, just grab it, squeeze it, and you see how more durable it is, and now it's able to move.
And this was all red, this is red, but then it turns into like this fatty liquid, and as time goes on, it'll be fatty liquid after a while. Right.
So then he holds it.
If I can do
Here,
both of
I'll
those.
hold it.
Right.
There. And then you get another alcohol swab, and then you open it. Again, try to get as close as possible to the cord, but not too close to where it hurts, you know, whoever you're doing it to. So I just try to pinch it, and you can see when I did that, immediately his drain started to drain more. So if I keep doing it, see, it's shooting down. So
Keep
the suction
pressure on it too, so it doesn't shoot back.
Yeah. So you just keep milking, and these are very elastic. If you can see, if I am pulling it, they're very elastic. So you can stretch it and pinch it as hard as you want to get as much of it out. And then you can see all that just going down, down, down. There you go. And then you can see it dripping into his actual grenade.
And that way you get all the junk out. Because the first couple of days we were doing it with the cap on, and it wasn't getting any of the junk out. It was just slowly pouring into it. So.
And sometimes if there's still a little bit left, you can always let go and suction it back out like this a little bit. So what I do is I go further up, hold it, and then just do it again. That way it's just the force of the air is just pushing it down, down, down.
And you get all of it out.
Yeah. There, and then when I'm done, I let go slowly.
So it doesn't shoot back up into my arm.
Right. So then you, again, take it, get your little cup. Make sure you find the CC. Hold back the nozzle. And
Drain the gook out.
drain it real slow. You see all that? It's mostly fat, and remember you gotta shake it a little bit just to get the majority of it out. But just make sure you don't squirt it in your face. I did that. So then you check it, you look, and you say, okay, this is about 5 cc's. So then what you do is you go either to your bathroom, to your sink, toilet, whatever, flush it down, clean out this, and then, you know, do it again in a couple more hours.
And the doctor gives you a pamphlet to record everything.
So, again, clean the nozzle, make sure there's no blood on the outside and it's clean. Again, face it away from you, squeeze all the air out, put it back, and then it looks like that. And then you hook it up to them. There you go. Okay. On his chart, and you record all his measurements all the way up from day 1 to now. So then you just record, so it's about like 10.
And you can see, you do it 3 times a day, but you can see from the first day, you can't really see on here, but it was
65 cc, and now it's only up to 2.5 cc, so it's gone down dramatically.
Which is what you want to see in your tubes. Okay, and then after you're all done with doing the drains, you put this stuff on there. It's the Bacterson zinc ointment. It's a first aid ointment, and they'll give you a tube of it at the clinic. The nurse will give it to you, and then you just take a dab of it and you put a dab of it on the actual incision so it stays lubricated and doesn't dry up and crack. Yeah, it's gonna look nasty under there, but whatever. And you're good to go. Alright.